Hi everyone, I'm Dr. Ajay Kher, a nephrologist at Epitome Kidney Urology Institute, and today I'm going to be talking about kidney disease. And for those who have chronic kidney disease that has progressed, how to choose between dialysis and transplant. First, it's important to note that there are two kinds of kidney disease: acute kidney injury and chronic kidney disease. For those who have acute kidney injury, what it means is that the kidney damage has happened over a few days or a few weeks. And once we've recognized the cause and treated the cause, the kidney damage or kidney injury can recover. So even those who've ended up requiring dialysis for acute kidney injury can come off dialysis and come back to normal or be off dialysis for many years or forever. So that is acute kidney injury. However, chronic kidney disease means that the kidney damage has happened over months and years, and the damage then becomes irreversible, meaning it can't go back. Because kidney disease can be asymptomatic, many patients may only find out about their kidney disease once the chronic kidney disease has reached towards a function of less than 5 or 10%, at which point they get symptoms of kidney disease, which may be like nausea or vomiting or itching or poor taste or poor appetite and weight loss, a combination of these issues. And at that point, when the investigations are done, we recognize that this is now chronic kidney disease and that the function is less than 5 to 10%. Once kidney function reaches less than 5 or 10%, then at that point in patients with chronic kidney disease, the options are transplantation or dialysis. So now let's talk about for patients with chronic kidney disease that are at the kidney function of less than 5%, how does dialysis rate or compare versus transplant? So if we compare the two, transplant is the better option for most patients for three main reasons. The quantity of life is likely to be higher with a transplant. The quality of life is likely to be better with a transplant. And the costs are also going to be lower. Let's discuss these in a little more detail. So if we look at 100 people who are starting dialysis and we look at 10 years later, 80% of them would have passed away and only 20% of them would still be alive on dialysis. In comparison, when we look at 100 people who've undergone transplant, 80% of them are going to be alive at 10 years. In comparison, only 20% would have passed away. So if we look at dialysis versus transplant, the quantity of life, the number of years you live is going to be higher with a transplant compared to dialysis. Next, we look at quality of life. On dialysis, if it is hemodialysis or blood dialysis, you would have to go to the dialysis unit 3 times a week, 4 hours each time. In addition, there are a lot of fluid and food restrictions that are there for patients on dialysis because they're only getting cleaning of the blood 3 times a week. In comparison, in peritoneal dialysis, there are less food restrictions, but still a lot of restrictions and you have to do the dialysis every day. When we do a transplant, the main requirement and the main thing that you have to do is make sure that you take your transplant rejection medicines or transplant medicines regularly, and you have to continue that for the rest of your life. And so you do have to take your medicines, but all the other restrictions in terms of food, diet, as well as needing to go to the hospital or needing to do dialysis, all of those vanish. And so the quality of life for a person is also much better with a transplant compared to dialysis. And lastly, the cost. The average cost in India for someone on dialysis is 30 to 50,000 rupees per month. In comparison, the transplant medicine cost after the first few months is somewhere between 5 to 10,000 per month. And so the costs are also much lower with a transplant compared to dialysis. Yes, there is an upfront one-time cost, which can be large, but afterwards, if you look at 2 years, 5 years, 10 years, the overall costs are also going to be lower with the transplant than dialysis. For transplant, there are two donor options. One would be a family member, which would be a living donor transplant, or someone who's had a car accident or a stroke and is brain dead, and that patient's family donating, and that is called a deceased donor transplant. For deceased donor transplants, there is a waiting time, and that waiting time can stretch into many years, on average 3 to 5 years. And so, in comparison to a deceased donor transplant, a living donor transplant can be done immediately after the workup of the donor and the recipient is completed. And so, that provides the best option for someone to proceed for transplant. For living donors, there is a full workup that is done, which includes blood tests, urine tests, ultrasound, CTs, heart testing, all of that. And only if all the workup is normal do we proceed for transplantation. And so it is important to recognize that if the donor workup is all normal, you can live a full and healthy, normal life with no restrictions going forward. It is important to recognize that the first successful transplant between brothers happened in 1954, and the donor lived till 2010. So he lived a full life after donation as well. So again, to summarize, for those who have acute kidney injury, it is important to recognize the cause, find the cause, treat the cause, so the kidney injury and kidney damage can be covered. For those with chronic kidney disease identified early, important to slow down the kidney disease so you don't get to a function of less than 5%. Once chronic kidney disease has progressed to a point where the kidney function is less than 5%, at that point, transplant and dialysis are the two options, and transplant is the better option for the reasons that we mentioned. And finally, a living donor transplant with a family member as the donor is the best option in transplant as well. Thank you.